Hello everyone, it's Dr. Mitch McKee from Berry Farms Animal Hospital. Today we're going to talk about your cat and reasons it may need blood work and what blood work is for, and how those better help us understand how to treat your cat if there's any issues going on.
Dr. Mitch, what is lab work for a cat, and how is it done?
So lab work is the same thing as blood work typically. Usually that involves drawing a blood sample. Most often we're using the jugular vein, which is a vein that runs just under the neck. Other times we may use a leg vein, a front leg vein or a back leg vein, depending on what test we're running. But what it allows us to do is take your cat's blood sample and put it through our analyzers here and compare it to what the normal values are for a normal cat, and that's how we detect disease. Also, lab work sometimes involves us getting a urine sample, which can be collected through a special cat litter or through a small gauge needle that we put in the bladder to retrieve the sample.
How does a baseline lab test impact the health and well-being of your cat?
Well, having a baseline lab test is important, especially early on, because it gives you sort of a timeline of when things may or may not have occurred. For instance, if your cat's blood work was normal a year ago and this year it wasn't, then that kind of tells us, gives us a little bit of an indication about when and where the problem could have happened. So having a baseline blood work is always a good sort of foundation to have for your pet's health assessment.
What specific things are being looked at using my cat's blood work, and what health conditions can they help detect?
So blood work basically involves 3 to 4 different procedures. One is a CBC, which assesses your red and white blood cell counts, looks at your platelet counts, as well as certain cells within the white blood cell count line. The other component is typically a chemistry. So a chemistry looks at values that are related to your kidney function, your liver function, your protein levels, related to your pancreatic function, and oftentimes a thyroid level. And then, as we spoke about earlier, a urinalysis tells us whether there's bacteria in the urine, whether there's red or white blood cells, or potentially crystals or other types of cast. Aside from those, there are other tests that can be done to detect certain viruses. So in terms of what we can diagnose with blood work is quite a lot. Kidney failure, liver failure, diabetes, thyroid disease, viral diseases such as feline immunodeficiency virus or feline leukemia virus. And then past that, we can detect if there's protein levels that are low, or are there issues involving the electrolytes or calcium deficiencies or excesses.
Is blood work alone enough to ensure a proper diagnosis of a cat illness?
Not always. So we do see cats that are very sick that can have normal blood work. That's why it's always important to do a good physical exam. Using our hands is oftentimes better than our tests sometimes in determining what might be going on. And there are other times when you may need imaging such as X-ray or ultrasound.
Why is early detection and diagnosis of cat illnesses using lab work so important?
Early detection is important because it gives us the best chance we have to, 1, detect disease, 2, if we do detect disease, it gives us the best opportunity to try to prevent the progression of it if we can. It also allows us the opportunity to use as many modalities of treatment available to us to help improve quality of life and longevity of life. If you have any questions about your cat and anything related to cat lab work, you can always let us know.